Good morning, everyone. If you happen to be in the European time zone, or good afternoon or good evening when you're somewhere else on this planet, very happy to welcome you to the second episode of our conversations here on LinkedIn Live around implications of exponential technologies. Today, I'm with Eberhard to talk about healthcare evolution. And before we jump into that, Eberhard, you will have time to introduce yourself as well in just a second. But I just want to frame the opening from a comment you actually put onto LinkedIn under the session where you were talking about fax machines. And for the ones that are probably not living in Europe, we might need to explain what fax machines are, because apparently it's a European thing that you still use fax machine to transmit information in the most retro style that is possible. And in Germany, it's a big thing actually to use fax machines, especially for financial transaction and healthcare. And Eberhard, when you're talking a little bit about also what you're doing, my first question to you would be, when we're talking about healthcare evolution and this typical technology gap that we see quite often being existing, so what is actually possible to how we're doing things, how big is this gap between reality and technological possibilities actually in the healthcare sector?
Yeah, first of all, hello everybody. The gap is actually pretty big, and fax machine is just one machine or one technology that's still in use. Actually, it was invented in Germany. Maybe that's why it's so popular still in Germany, but it was commercialized in Japan, of course. Anyway, but it comes pretty handy. You don't have to do anything. You take something that's you've written, you put it on the fax machine, and it appears in the same form on the other end at the recipient's home or hospital. So this is pretty easy to use. You don't have to install anything. It's just there. Of course, it's not protected, so everybody can listen into it. But sometimes you don't care. And I would say that still, like the travel industry, healthcare industry, are those two industries that still keep the producers of fax machines alive.
I love this part, especially that you mentioned the security aspect and this listening into machines, and especially when we're looking into healthcare. And I just had this conversation actually yesterday, also with a hospital, and I was like, oh, this data protection is like so tough for us, but then at the same time you're sending this data basically openly available for everybody that knows how to get into the system. And as far to my understanding, I'm not a hacker, it's not too difficult to grab information that is being sent by fax. So I think that's a really, really interesting point, like how reality and like what we wanted it to be, like in this case, really protecting data, and then the technology that we're using that are actually not enabling that is, yeah, sometimes even just like it even feels like a little bit ironic, I would almost say. So that's a really interesting point. And I want to talk about this in a second. But before that, let's quickly explore what you are actually doing, Eberhard, because you're having a really interesting background, because you are actually building the tech infrastructure layer for healthcare, facilitating, amongst others, also the blockchain. But you are actually a medical professional also from a background. So you actually have been working in the healthcare industry as a non-technical profile. How has happened that? What inspired you to go out there and build this infrastructure?
Well, first of all, I'm a psychologist by training, so that always involved a lot of number crunching. So I was mainly working in research, but of course I was also working in clinical settings. When I returned from the US, I was working at the University Hospital in Zurich, and mainly in research, transplantation, medicine, organ donors. But slightly, I moved into the direction of online consultancy. I was head of the online consultancy service at the University Hospital in Zurich. That's more than 20 years back. See how old I am already. But this is how I got into the digital health arena and have been there ever since. So from the outside, it looks like there's a clear disruption of what I've been trained and what I'm doing. I would say that's a natural evolution. If you're collecting research data, numbers, you digitize them. There's the transition into the digital health area is very fast. So because if you transmit numbers, data, you immediately get exposed to those questions. How secure is the transmission? What do the data tell you? Very often you have a lot of trash in, trash out. I guess we are going to talk about this in a while when we talk about AI. So I would say that's an interesting background, of course. It's not the natural course of psychologists ending up in digital health area, but for me, has been a journey that has a beginning and not an end yet. So.
I would be sad if there would be already an end in sight, right? Because you have so many years in front of you, even though you framed it that you're already old, but I wouldn't agree to that point per se. Eberhard, so like this is how the story a little bit unfolded and what you're currently building, and you mentioned already AI to a certain degree and data structures. For everyone that is not too familiar, probably also with blockchain and what you're doing, can you quickly explain what is your main intention and the main starting point of where you built this infrastructure with blockchain? What was like your main motivation in the beginning, and then what were like the critical steps that you have been working on?
Yeah, it started all in 2016 when I got a call. I think people who listen in and have heard this story in other podcasts as well, is that I got a call from one of the founders of the Crypto Valley Association. Are you still in digital health? And I said, yes. So we have to do something with blockchain and healthcare. And that was 2016. And ever since I got pulled into that very interesting area. We have to admit, healthcare is a very conservative field, and blockchain has not really arrived in everyday life of hospitals, patients, and so on. But the initial idea that we had was that we tokenize health information. Why would we want to do that? Because in research, we observed, and we still observe, that everybody is on the hunt for data. And I mean, it's not only AI companies needing the data. It's basically, if you develop new therapies, new drugs, you need to have data. So everybody's after that data, but the one person that's not really interested in data is the patient or the user who's interested in healthcare themselves. So, and we thought we can change that by incentivizing them when they share the data. So that was the background of tokenizing health information, so that people are more prone to share their data, or more willing to share their data when they get paid. That was the original idea. And then everything changed a little bit along the line. We had Corona, a lot of inquiries. Could you do this? Could you do that? And in the end, we decided that we focus more on infrastructure, like a layer one blockchain for healthcare without the noise of the other industries. And so that's also where we are now, where we think finally we did a technology upgrade just recently to the Cosmos ecosystem. But what we want to do is providing the Web3 infrastructure, or the operating infrastructure for healthcare. And what does that mean is basically you're providing certain elements that are key to most projects, just not in the Web 2 way, but in the Web 3 way. For example, verifiable credentials, digital identifiers, stuff like that. And not to talk about the whole peer-to-peer payment processes that can be involved in Web3 healthcare projects. You muted.
what happened here? Sorry. I absolutely love this, Eberhard. This is I find this such a fascinating topic because I think there's a lot of like also possibilities that can be build on top of that. Maybe just like making this a little bit more tangible, because I know you have like so many great projects. What is like one of the projects that you're most proud of that you have achieved over the years in the healthcare space? So like a use case or application where you think like that really benefited many people involved.
Well, one of the projects was just what I described. It's a legacy project that's currently on hold, but it was treatment monitoring data when people with rare diseases share their treatment data, for example, bleeding rate in the case of hemophilia. Then once they share the data, they immediately find tokens in their wallet, which they then can use to redeem certain services in the healthcare field. And that was actually one of our first projects with Big Pharma. And you might wonder what's the interest of companies like that in incentivization, data sharing, but they not even get to know who the person is, because blockchain technology was used in that case, or is used in that case, to protect the privacy of the people. They're just a string, a hash. And the second one was incentivizing them when they give the data. And here we're touching an interesting part or a mega trend in healthcare, which is what's the most valuable data set in healthcare? Most people would say my DNA. Let's be honest, nobody cares about my DNA unless I'm Joe Biden or I'm a famous person, where it might be interesting what diseases I will develop or most likely will develop in the future. So otherwise, my DNA is not of much value. So what then is the most important data set? That's the course of the treatment side effects. How good does the treatment work? And why is that so valuable? Because it directly translates into profit for treatment providers. If you think that healthcare gets more and more personalized, that also means it's getting more and more expensive. If you look at your healthcare premiums, they just know one direction, it's up. So how can you fight that? You can develop 2 or 3 class medicine. Say the ones who pay a lot, they get everything. The ones who pay little, they have a hard time to get their treatments reimbursed. So what is one way of reducing costs is because medications get expensive every time, every year. So new drugs come out. They are very expensive, especially when they treat rare diseases. The most expensive treatment is spinal muscular atrophy. And some companies, for example, Novartis, they say we have a one-time treatment. You take it once or you apply it once and you're cured. So that's why it's justified that one treatment costs more than 2 million US dollars. But then the health insurances, the payers say, okay, we cannot pay that to everybody. So, but they want to avoid, for political reasons, that you have to make the decision. Okay, we paid for this person, but not for that person. So, what's a way out of that? Is say, okay, we paid if when it works. So, and how do you measure the efficacy of treatment? Is by measuring treatment outcomes. The most hardest treatment outcome, of course, is survival rate, how many days a person survives, but it's also quality of life, especially in cancer patients or rare disease patients. So you have to measure that. And in order to get that data, this is really expensive to get. You have to have a nurse calling, you have to ask the doctor. And one way out is to make that process digital. And that's basically what we did. We gave the platform that treatment providers and patients can exchange their data while preserving the data privacy or the privacy of the person. And this is probably the best projects we did on blockchain. But I tell you, we have a couple of projects coming up that are even more interesting.
Why is I don't understand why my microphone is muting all the time. I had the same with another session, so sorry about that. I'm really excited to follow up on that also in the next couple of weeks and months. Then Eberhard, so probably we will have another session someday in the future to talk also about more of those recent developments. But I mean, you touched up on a really interesting aspect already, which I would love to talk about, and this is how do you integrate actually these solutions in like legacy infrastructures? I mean, like in this case, you had like a particular use case, but I assume like one of those big challenges is like still how do you bring your technology in front of the users? How do you integrate it into existing infrastructures? How do you convince people that this is a good approach? How do you make sure that everything comes together in a nice play? And this question is probably really relevant for what you are doing, but I also think in general for every technological advancement that we're seeing, we quite often see this big challenge of how do we actually integrate this now into legacy infrastructures with the least hassle, or like how do we make it as easy as possible to avoid that we are integrating for 6 years just to figure out that by the time we have integrated it is already outdated again. What are your lessons learned and what are the challenges that you have identified?
Well, I guess there are two levels of integration. One is the technical integration, and the second one is the integration to the process. If you need to have your solution being integrated in the technical layer, then you're dead. I mean, you will never go past by of these large system providers, for example, Epic. They're just there, and of course, they're protecting their market. It's not just Epic; it's basically everybody. And if you look at in April, there was the biggest fair of digital health in Berlin, DMEA. And I would say 50% of all the solution providers there live on the lack of interoperability in the healthcare space. That means that integrating into existing technology layers is very difficult. The second one, the integration in the process, is also difficult, but there, of course, the investment that we are looking at is not like, first of all, you have to put millions on top of the table to just have the technical capabilities of integrating. In the process layer, you can integrate if you have people who are motivated. And that's actually where we find that emerging markets are way more open to integrate new technology. They leapfrog all the PC and mainframe infrastructure. So, for example, if you're looking at supply chain tracking on blockchain, this is what a lot of people think about low-hanging fruit in blockchain technology in healthcare. You can, on the technical level, if you have to integrate into the supply chain layer of big pharmas, very difficult. Lots of investments, lots of hesitation from the big players to touch their core processes. But they're open to do small trial projects if they don't have to change their setup, and if failure is not expensive. So we have a project together with the Swiss Tropical and Public Health Institute in Western Africa, where basically the post-exposure medication for rabies, if people get bitten by a dog and the dog has rabies, that's if that goes untreated, you die 100%. So it's not like COVID, so low mortality, but 100% mortality. So it's very important that this medication gets to the people who need it. But what happened really was that 50% of the medication got lost on the way there. So, and then in a context of a research project, blockchain tracking was implemented, so that, and the totally went away, that medication disappeared on the way back. But what I'm trying to get at is that was done in the context of a research project, low budget, but motivated people. So that means we offered them something that they could use on their mobile phone without having to integrate in large technical infrastructure. And I would say that for Web3 applications, and we're talking about mainly blockchain applications here in healthcare, if you offer a solution, it has to be mobile. And you don't have to ask people to do integration into existing systems. And how do you do that? Okay, the mobile part, that's quite easy. You have a web app, you connect your wallet to the web app. That's basically, if you're familiar with blockchain and if you have used one of the decentralized exchanges like Uniswap or PancakeSwap, that's basically the same process. You have your wallet, you connect to the application, and you can do something, move your tokens. And once you disconnect, your data doesn't exist on that platform anymore. It exists on the blockchain, of course, but not on infrastructure provider where you have to provide, where we have to trust the people. So this is basically the Web3 approach, and we follow the same approach in healthcare. You have your data, you bring it to the application, you connect it, and you are the guardian as a patient or as a user or the gatekeeper to your data. And this is basically where I think that's the way to success. And the data, of course, if it's in a format that's interoperable, and we have those formats like FHIR, for example, FHIR, that every system, every modern system can read. And so you basically circumventing those technical integrations and make it easy for other systems to read your data. Basically, what we are trying to achieve with the infrastructure is that every user, every individual user has a right to their data, has a copy of the data at least. I'm not talking about the original data, but at least you should have a copy of whatever happens. If you go to get a vaccine shot, of course, I want to have a copy of the digital event. It's a verifiable credential in technical terms. Once I have a copy, I can also decide then to share it with someone else. That means the next time I go to get a shot, I'm traveling, I can share that data when I'm the gatekeeper in a format that they can read, and most systems nowadays can read that file format, so that he can read it and import it in his system. So that's basically the way around that you really have to have a deep technical integration into existing systems.
And how do you see this, like from the end user perspective? So I'm looking at it. Maybe this is also a very German perspective, but if I think about like all the healthcare records that are existing about myself, I'm luckily not that often sick, so they are hopefully quite limited at this point in time. But still, they are like scattered around. I don't really have like this data. The best like I probably get is like a PDF printout of my, I don't know, blood test from the lab, and then I just have like this data point on a PDF, but I can't really access it digitally. How do you see that openness? Is it opening up from the system so that people can more make use of their data, or is it still like this? Oh, I need to type in everything into my Apple Health or whatever kind of other health app I'm using myself, and typing it in manually. How do you see this is evolving to a certain degree? I know there's like initiatives starting that this data is more available, but still I think for the end user it's quite hard to source, at least when you are in Germany.
Well, it's the same here in Switzerland. I mean, it's a long process. But for example, I was in the hospital, in the emergency room, not for myself, because my son, he cut himself. And he was bleeding very heavily. So we went to the emergency room and he got stitches. And then they asked, okay, is his tetanus status up to date? And I said, well, I don't know. And then we were trying to find this information in a PDF from past experiences in the emergency room with this kid. So, and I couldn't while being there. So I would have been happy to have just a PDF with the necessary information at that point. But of course, that's, if you think what's possible, if you look Instagram and so on, ChatGPT, I mean, the gap between what's possible and what can already help you in real life is pretty big, but not even that is possible right now. And so PDFs are okay, but of course that's not ideal. I mean, seamless integration, automatic import of the data in the format that I just mentioned, that would be ideal. But if we look what has happened, I mean, they started in Switzerland in 2007 to write a law about or a strategy about the patient dossier here in Switzerland, and it's the same in Germany, but Germany is just bypassing Switzerland right now. But it's a little bit the same in all industrialized countries, that the access to your data and the different data silos is quite difficult. And I would say that the only solution, I just mentioned that, is if I, as a user, as a patient, have at least a copy of the data that I can then share. For example, in that emergency room, if I could generate a QR code with that information, give it to them, they scan it, and they take it into their system. Very easy to implement, but it's not there yet. What I will see, and maybe we should also touch a little bit on AI, what's ahead there. I mean, take vaccination records as a prime example. My vaccination record, I still have that from the military, and that's almost 40 years old. So, but I still use it because it's on paper, but it's there. It doesn't get lost like the electronic record that they had in Switzerland for a couple of years. Data just disappeared. So what's ahead in the future? So what if AI, I mean, AI is now multimodal. It's not just speech or text, it's pictures and everything. So what if I take a picture of that very lousy old vaccination pass, and then the AI converts that into real machine readable data that can be transferred between systems and read and read from other systems? I mean, this should be on the agenda of a lot of tech companies, but maybe we have to do it ourselves. But I think AI will accelerate a lot of data processing in healthcare, and hopefully also streamline treatment processes in the future.
I hope they do significantly improvements on reading very, very bad handwriting skills. I'm not sure how it is with your doctors in Switzerland, but if I think about the handwriting of all the doctors that I've ever seen, I'm not even sure if they can read their own sentences and their own structures. So I'm like really looking forward what AI will produce out of these old school handwritten notes that are in my patient folder somewhere on this planet.
Well, that's absolutely true. I mean, handwriting of academic people, especially of medical doctors, is really bad. But think about, they use AI to decipher old hieroglyphs and old papyrus rolls. I mean, those programs should be able to deal with doctors' handwritings.
I'm pretty sure there will be some AI engineer out there having a very hard time with this topic at hand. But hey, every challenge should be there, right? So it shouldn't be boring for the people. We have actually an audience question from Daniel, which I want to pull in and which I think suits quite nicely to what we were just discussing. And Daniel is asking how actually digital health solutions can improve the accessibility and affordability of healthcare overall. I think you mentioned already a couple of topic. On the one hand side, that you have records that are probably usable for better treatment on the one hand side, but also probably this better availability of infrastructure and data points, and then also machine aided diagnosis can probably help also lower the cost of treatment. What's your take on this question?
Well, absolutely. I think that accessibility is a key driver of digital solutions. I mean, what's the most expensive resource in healthcare? It's a doctor that needs to study 8 to 10 years before you put them in front of a patient to answer questions. And then you use 50% of their time for administrative stuff. So that's not really good use of very expensive resources. So why not make AI-based solutions the first line of interaction with the healthcare system? And that would also lower the threshold of a lot of people to access health information. Why is that? For one, very often diseases or symptoms can be stigmatizing. So people will not visit the doctor or hospital because they think, okay, now everybody knows what I did, that I went on vacation and I got this really bad bug. And the only way I get that bug is by cheating on my wife, for example. So that can lower the threshold of accessing the system at all. The second reason is it's more affordable. I mean, I just read this story about the German guy who was on traveling in the US, and he was 4 hours in the ER in some US hospital, and the bill was 11,000 US dollars. So I think in a lot of countries where health insurances don't exist, or they cover very little, or they are you don't know what the bill at the end is. People are afraid to go to the doctor because I heard from a friend that 70% of all personal insolvencies in the US, for example, are due to unpaid medical bills. So that means becoming sick in a lot of countries can ruin you. So if we talk about accessibility and if we have AI systems that you can ask, I mean, that's the typical symptom checker that was around for many years. That already gives you access into healthcare systems. And then the second part was affordability. Yeah, we're in the midst of affordability. Then I would say that especially AI will bring a lot of improvements in that field, because it also relieves doctors. I mean, if the doctors are scarce resources or nurses, then AI can free some of their time because they don't have to see cases that don't really need to be presented to a doctor. Nowadays, everybody runs into the emergency room because the traditional family doctor, nobody has that anymore. So I don't have a doctor. I feel sick, so I go to the ER. And ERs are swamped with cases that should not be treated there, because they should be open for very severe accidents and so on. So I guess in the sense of accessibility and affordability, those exponential technologies like AI and blockchain can do a lot, because blockchain can also be used to free up resources in the payment processes and the administrative processes. If you have smart contracts being executed without human interference, if condition A and B are met, then C happens. That will also bring a lot of interesting movements, especially in I would say health plans and health insurances that are the equivalent of the banks that you want to get rid of with DeFi solutions. I would say that we will see a similar tendency and movement in the future in the healthcare industry, so that will also reducing administrative costs, will also make healthcare more affordable.
And I guess like many of those points that you just touched up on are not only contributing positively to the accessibility and affordability part, but also to the overall quality that a patient can expect in the treatment. Because I would assume if a doctor can spend 50% more time with patient interaction rather than documentation or administrative work, that this will positively contribute either on the capacity side of things through less waiting times or like more availability of treatment, but then also at the same time, probably your checkup doesn't take like 5 minutes between two coffee breaks, but you have like a more qualitative orientated treatment that increases the overall patient welfare, then, if we want to put it like that, right?
Well, that's a common trend in healthcare, that you don't have less and less time that you can spend with the patient if you're a dietitian or a physical therapist, not only a doctor, because everything is so profit driven. So that's a common trend, and of course, digital solutions can free up some time. It can also make it's not necessary that patients come in person. That saves them time, but also those systems, they don't get tired. So that means if a doctor has or a nurse, they worked all night. Of course, there's still people think, oh, I'm so heroic, I can do that. I can do surgery 24 hours a day. My quality doesn't decline. So truth of the matter is quality declines in humans. So we need to sleep, we need to rest, but computers don't. They just, you feed them more energy. So then they don't get tired. They can perform the task at the same quality all the time. They don't get bored by repetitive tasks. So I would say that we will see, I mean, in the radiology departments, for example, we already see those systems at work for many years, because they see patterns where human eyes don't see patterns, and they can do it 24 hours per day. So of course, those systems and the use of those systems is inevitable. The only thing that remains is who pays when something gets wrong, who's taking the responsibility. And in countries where you have a lot of lawyers, like the US, liability is certainly an important issue. And so where's the liability if something goes wrong? Now, until now, it's the doctor or the nurse, the person who makes the mistakes. And the issue about software as a medical product really touches on that. You have to certify that your software is making no mistakes, but that makes innovation very slow. So I don't know if you're familiar with the situation in Germany where you have the app auf Rezept. That means app on prescription. That means your doctor can prescribe you a certain application, an app, and it's being reimbursed by your insurance. The concept in itself is good to prevent people from apps that are really bad, that can cause harm, but also it makes getting to that point very slow. So that means it also basically prevents innovation.
Like that. And I want to pick one word that you just mentioned from the prevention part. Probably also like another prevention part in healthcare. So like we talked a lot about like also like what's actually happening when you need an actual treatment. How do you see like especially data pools and like AI solutions also helping patients or like people in general in the future probably not getting sick or living a healthier lifestyle? I mean, you had like also projects or like working on projects like where it's all about like movement, where you can earn through the movement aspects. So how do you see like the whole evolution also towards more of a preventive approach, so that we're ensuring and helping and diagnosing before actually something happens, so that we're actually not getting sick to a certain degree? How do you see that part in the healthcare evolution?
Right now, our healthcare systems are designed to pay for repair. So prevention is not being incentivized. And if you look at the budgets of health insurances, there's very little part for prevention, and it mainly comes out of marketing. And why is that? Because it's not so sexy to say, okay, if you have a head trauma, we pay you. So they rather show healthy, fit people, and we also pay that. Or if you give birth, we also pay you a nice hospital. So that's coming from marketing in a lot of cases. But we all know from real life that repairing is always more expensive than preventing something. So the incentives, the whole incentives in the healthcare system should be in a different direction. They should be, you should put the money there where prevention is being done. But the highest paid professions in healthcare are the ones who repair people. And that's also why costs go up, because there are a lot of unnecessary surgeries being done, especially in Germany. Germany, I think, is the leading country for artificial knee prosthesis. So the question is, other countries, people are not so sensitive to pain, or what is the reason for that? And very often you just look and the cash cows of the medical procedures. And so the incentives very often are set in a wrong way. And I would say that digital health can be better applied, or digital health applications. You just already mentioned our Health to Earn application, where you run and you earn tokens. Or the next steps will be you eating healthy, you get tokens. You do something to improve your mood, you get tokens. So I would say that tokenizing stuff in healthcare can support the prevention efforts quite well, because you can do it in a very cost-efficient way. We have currently that Health to Earn model. We have a model where an employer, it's geared towards corporate health. You spend $5 on each employer per year, so that they can either do physical activities, analyze their food, or perform mental well-being exercises. So we call it, the employer sponsors data points. But those data points basically trigger the payouts of amount of token, depending on the quality of what the person did.
So also like a shift in the business model aspect. I really like this aspect, and I think Eberhard, with that, we are closing this session for this particular moment. I mentioned already earlier I would love to do this again in a couple of weeks or months when we see like more of this evolution happening, and also talking more about this business models that you were just touching up on. I found this like a very interesting insight into the world of healthcare and how you're approaching that, what you're actually doing there. My last question always for these sessions is like, is there anything that I didn't ask you that you would definitely want to share with this audience before we're jumping off? Otherwise, thank you for your time, Eberhard, and I'm really looking forward for the next session here. The last sentence for you.
Yeah, first of all, thank you for all the questions. I mean, you gave me many more questions for preparation. I guess we save them for the next time. And yeah, it was really fun. And maybe we can do one session from the sailing boat in the future.
That would be a lovely one. And for the ones that are dialing in, Eberhard and I are sailing together since a couple of years every October with a bunch of tech people. So if someone is interested, leave a comment under this session. We might still have a space on one of the boats in Croatia this year. Thank you so much, Eberhard, for all your time. Much appreciated. And for everybody out there, I wish you a wonderful rest of the day. And see you very soon for the next session, which will be announced in a couple of hours on this channel. Thank you so much. Have a good one.
Thank you.
Bye-bye.